Welcome back to AM Northwest. Right here to tell us about a procedure designed to take years off your face to give you that younger, healthier look you deserve. We're happy to welcome back from aesthetic medicine, Dr. Jerry Darm. It's younger, not longer. Look. Longer. That longer look. Well, you know what? If you look younger, you feel younger. You're young.
Yes,
your lungs are younger.
Yes, you
all right. What we're talking about here is the MiniLift. Explain the MiniLift.
The MiniLift is a facial plastic surgery procedure in which, there's an incision here by the ear and goes behind the ear and back that way. Very small incision. In women, it actually goes behind the, what's called the tragus there. So it's not particularly
visible. Is that what that's called, that little piece of skin there? Is the tragus?
Tragus, I think so.
Wow. Keep that in mind. That's a great part.
Sounds like a grill. But
anyway, some of the skin is taken off, and then what's called the SMAS, which is the connective tissue underneath, is tightened. And so that gives you a long-lasting, up to 10 years.
Oh, that looks great.
Procedure, and it's a very natural look because, we dissect down and we free up what are called the nasolabial folds, which are those folds right beside the nose. And so, unlike Kenny Rogers and unlike some of the others, this is a very, very natural-looking procedure.
Done incorrectly. I mean,
disaster.
I told you on a flight one time, the flight attendant had so much work done, he had a look on his face of terror, like something horrible had just happened. And that's not the thing to have on a flight. Every time you turn the corner, it was this.
Oh my God! Surprise!
Yeah, the wrong kind of work, too much.
Surprise!
So right. Yeah, you don't want that in a flight attendant.
And you don't want them to smile because
so you have a board-certified plastic surgeon on staff.
Yes, we absolutely do.
Yeah, that's important.
And he's very good. He's 30 years of experience. Developed these techniques over all those years, and just a prince of a guy and a gem to work with, and bottom line, he just does a wonderful job. It's just a natural look. It's 10 years younger, and it'll last for 10 years. And in the case of his wife, it's lasted for about 20 years. So
who makes a good candidate for something like this?
Well, if you start getting this sort of a jolly look, with where these areas start to sag, or if you start getting some, wrinkles in your neck and so on, then it's a good look. Also, you can do a little bit of filling with the the fat graft, so you can bring the volume back as well.
And the fat graft is where you take fat from another part of the body.
Yeah, just like a fat transplant, basically. So take it from the tummy, put it in the face.
What about recovery?
There's definitely some downtime, at least a week.
But it's much less than a full facelift, isn't it?
It's with his techniques that he's using, there's very little pain afterwards, but obviously, the tissues have to heal, so that's going to take some time.
Okay, so, and you say it lasts for 10 years. At the end of that 10 years, if you want it done again, you can do that?
You can do it again, or you can do the non-invasive laser treatments to get some tightening and to make some improvements that way.
And you see both men and women doing
absolutely,
this, right?
Yeah, absolutely. Guys are interested as well.
We're a younger society now, right?
60 is the new 40, right?
Yeah, it is. Yeah, until you run uphill. But yeah, there's a I won't call it a vanity, but we're younger than our parents were.
Well,
as far
we're
as how
working.
We feel.
We're still working as we're older, and for some people, it's in their jobs, if they're in sales or if they're competing with younger people in the office place, it actually has an economic impact.
There are non-invasive ways to get these similar results. So there's got to be, I guess, a point for you and the other doctors at the clinic to decide when non-invasive will not get you the results you want.
Well, it's a patient decision too. We have some patients who could use a surgical procedure, but they opt for the non-invasive laser procedures, which certainly can give you some tightening and reduction of fine lines and wrinkles, but not as much, obviously, of a result as the actual surgical intervention.
Do you suggest any not operations, but procedures after someone's gone through something like this, or?
Well, if money were no object, then you do the surgery and the laser treatments because they do different things. The lasers help with texture. The surgical procedure is not going to change the texture of your skin at all. Your skin is going to be exactly what it was. It's got sun damage, there's fine lines and wrinkles, there's pores, pore size. So the lasers can do those things. And also, this area in here and here really, no matter how hard you pull on the face, these areas don't really respond. So those, smokers' lines
right,
and those,
right.
You really need the lasers but
They make a difference.
Yeah, they make a difference.
Folks would like more information. Aesthetic Medicine is where you go over in Lake Oswego on Meadows Drive, 503-697-9777. And thanks for coming in today. We appreciate it.
Thank you
Thanks,
so
Dr. Darm.
much.
No
and
one can tell by looking at you that you're
congratulations.
98 years old. by the way.
Congratulations on being back. Oh my God,
I
I'm
know.
so excited that you're here.
Me, you, me, her. My wife, not so happy,
God.
oddly enough, yeah.